You forget your keys once, no big deal. You forget names occasionally. Who doesn't? But when forgetting becomes dangerously frequent, when your personality shifts, when daily tasks confuse you, that's not normal aging. That's a red flag. That could be dementia, a serious condition that damages the brain and strips away the very things that make us who we are. It's not just memory loss. It's a progressive breakdown of how you think, how you feel, how you function. So what exactly is dementia? Dementia isn't one disease. It's a general term that describes a set of symptoms linked to a decline in brain function. It happens when brain cells are damaged, and when that damage spreads, it affects memory, decision-making, language, attention, personality, and more. The most common type? Alzheimer's disease, responsible for around 60 to 80% of all cases. But it's not the only one. There's vascular dementia, caused by reduced blood flow to the brain, Lewy body dementia, triggered by abnormal protein deposits, frontotemporal dementia, which affects behavior and communication first. Different causes, different symptoms, but one devastating result: progressive mental decline. Common symptoms of dementia: it doesn't start all at once, but when it does, it starts to take over everything. Some of the most common signs include short-term memory loss, like forgetting conversations or repeating yourself, trouble with problem solving and planning, getting lost in familiar places, confusing words, struggling to follow conversations, misplacing things and being unable to retrace steps, changes in mood, judgment, or behavior, and social withdrawal and emotional flatness. These aren't little quirks. They're signals that the brain is changing and not in a good way. So, what could be the causes and risk factors you need to know? There are many possible sources, including Alzheimer's disease, stroke or head trauma, infections that reach the brain, vitamin deficiencies, especially B1 and B12, chronic alcohol use, and thyroid issues or other metabolic disorders. And the risks actually grow with age, especially over 65. Family history, heart problems like high blood pressure or cholesterol, smoking and poor lifestyle habits, diabetes, and previous head injuries. The brain is delicate, and when its systems break down, the effects ripple outward fast. Let's now discuss the difference between dementia and normal aging. Here's where people often get confused. Yes, it's normal to forget things occasionally as you age, but dementia is not just aging. Here's the difference. Forgetting an appointment, but remembering it later. That's normal. Forgetting what day it is and not realizing it. That's not normal. Misplacing your phone and finding it. That's normal. Putting it in the freezer and not knowing why. That's not. Normal aging, just slows things down. But dementia disrupts them. So, how is dementia diagnosed? Well, there's no single test that says, yes, this is dementia. It actually takes a combination of steps to figure it out. Diagnosis often includes a thorough physical exam, cognitive testing to measure things like memory, attention, and problem solving, blood tests to rule out things like vitamin deficiencies or infections, brain scans to check for strokes, tumors, or signs of degeneration, and, of course, a review of the person's medical and family history. It really takes time and expert observation to make a clear diagnosis. But honestly, the sooner it's done, the sooner help can begin. Is there a cure? Let's talk treatment. Now here's the truth nobody really wants to hear. Most types of dementia just can't be cured. But the good news is, they can be managed. Treatment may involve medications to support memory and behavior, therapies to improve communication and daily functioning, lifestyle adjustments, like keeping consistent routines and doing brain-stimulating activities, caregiver support. Because, wow, loved ones carry a heavy emotional load, and environmental safety measures to help prevent accidents and confusion. Treatment won't reverse the damage, but it can, slow the progression, ease symptoms, and really improve quality of life. How does it feel like living with dementia? People with dementia often know something is wrong, but they just can't explain it. They may feel anxious, frustrated, or even afraid. Sometimes they might lash out, or they might withdraw completely. It's not just about forgetting birthdays. It's about forgetting faces, forgetting places, and sometimes forgetting yourself. And for loved ones watching this unfold, it's heartbreaking. That's why empathy is essential, because while their memory fades, their need for love, dignity, and safety never does. Dementia isn't something we can ignore. It's becoming more common, and it touches every family eventually. But it's not hopeless. When we recognize the signs early, get a diagnosis, and create a care plan, we can help someone live with more peace, purpose, and protection. Don't chalk it up to just getting older. If something feels off, speak up, because awareness isn't just powerful, it's life-saving. If you found this video helpful, give it a like and be sure to check out our other mental health education videos.